Let's go and see the doctor. That's going to make Cookie better.
Many of the hardest to treat pets in Britain
Right, it's hedgehog time.
are brought to one extraordinary practice, run by the man known as the Bionic Vet, Professor Noel Fitzpatrick.
What we're going to do has never been done before, ever.
He performs some of the most advanced procedures ever attempted.
It's the smallest total hip replacement in the world today. This is a textbook result. It's not even in the textbook.
As the lives of his patients and their families hang in the balance,
I've never seen an infection take hold this quick ever in my life, actually.
Noel continues to find new ways to give them a chance.
Of course, we don't know if it'll work.
That dog is the only thing that even makes me carry on.
Offering hope against all the odds.
Hello, hello.
She wants to say, hi, this is my new bionic leg.
It's just a miracle.
At Fitzpatrick's, staff are prepared to deal with dogs with all kinds of temperaments.
We see all sorts of patients coming through the doors. Some patients are a little bit easier to treat because they're fairly laid back and they want to be a friend.
Oh, Charlie. Ah, Charlie. Oh, my God.
Some are a little bit more challenging.
You're shouting at the wall. Stop it.
They maybe don't want to be friends with you.
No dog is aggressive because they want to be. They're aggressive for a reason. There's something that they're scared of, or there's something that they're not happy with. You know, so you just kind of have to figure out how to work around them.
Biggle.
That's enough.
Booked in to see Noel today is rescue dog Marley, one of the practice's more challenging patients.
Hello there. Great, would like to take a seat? Hi, I've got Marley, Noel's 9 o'clock here for you.
4-year-old Marley has severe dysplasia in his left elbow.
He's a typical German Shepherd, so he's a one-person dog, which is why he grumbles at other people sometimes. Oh. He's just got great personality and love him to bits. He does sled dog type sports in harness. I noticed last season that he was actually limping after a few of the events, and it's deteriorated quite a lot.
Mel has 4 dogs that she races in harness. Since discovering the sport 7 years ago, it's become a big part of her life.
I actually don't know what I would do without the harness sport racing. Over the past couple of years, I had a very difficult relationship breakdown, and it sort of set me back quite a bit. I knew I had to pick myself up. The fact that I had races lined up on the weekends always gave me something to look forward to. Marley's my top dog. He's the best, he's the fastest, he's the strongest. He's competed internationally.
Good dog. Keep going.
And he got a silver medal at the European Canicross Federation Championship last year. Marley's the love of my life, really. And racing will never be the same if he can't race anymore.
Marley has been referred and is booked in for an operation with Noel.
My colleague has seen him a few weeks ago. Apparently he's got elbow problems. Let's see, Mike, can you get him in, please?
The notes also warn that he should be handled with caution.
Hello.
Hello.
I'm Noel.
Melanie.
Melanie, nice to see you. Hey, sweetheart, how are you? I heard that you're a little bit nervous, maybe.
He can switch really quickly.
Really? What's the triggers for that? That seems strange.
Well, he was a rescue dog. Basically, he had been in a violent relationship situation, and so they put him in boarding kennels and then never picked him up again. So he was abandoned, and he was in kennels for 7 months.
7 months, mate?
Yeah.
You were in quarantine. That's a shame, isn't it? And when did you first notice the lameness?
Sort of around February time. He's actually a dog that has probably been suffering for longer, but you know he hides it as well. And
Oh, I see what you mean.
yeah.
That's what happens. So he just got triggered by something going on there,
Yeah, he's probably
and
just
he's like,
wandering
yeah. And this will be something that will happen over time. He'll do that. Yeah, that's interesting. He's definitely found his soulmate in you.
Yeah.
He's deeply distrusting of other folk. So, mate, I know if you're next to my testicles at any point and you lunge forward, I've got to be particularly careful. I've seen 2 episodes of it now, and I know that it can be like that, can't it, mate? Let's see him walk outside. Morning, Natalie.
Morning.
How are you today?
I'm okay, and how are you today?
I've got cold. I've got man flu.
Oh.
Yeah, I'm feeling sorry for myself. Let's go on the road out here.
He's got man flu, Sherry. Nolly.
Oh no.
Grum.
Go.
Before Noel operates, he needs to get an accurate picture of Marley's mobility.
Do we want to try to force plate?
We can try.
Yeah, we can give it a shot.
The force plate machine measures the amount of pressure Marley can put on his bad leg and the severity of the problem.
Good man.
Elbow dysplasia is a disease that prevents the humerus, radius and ulna from fitting together properly. This places pressure on one side of the ulna, causing cracking and sometimes wearing it away. To redirect pressure onto the other side of the joint, Noel will cut the humerus in half and insert a custom-made plate with a step in it. To enhance the repair, Noel's also turning to biology.
Hi, Marley. Nice meeting you.
If we simultaneously inject stem cells, we can get that environment to trigger those stem cells to grow into fibroblasts. Fibroblasts are the same tissue that fills that scar on my arm. So you're attacking it from 2 angles. Mechanically, you're unloading it and decreasing pain. Biologically, you're ensheathing it and decreasing pain. That's the plan.
The nurses need to prepare Marley for surgery.
Done, Marlies.
Pre-med's in. Yep.
But Marley doesn't want to come quietly.
Hey, what are you doing? What are you, a little horse? Hey.
Oh dear. I got you. We got you. You're all right. Good lad.
Let's just calm him down. Let's get an IV in.
Yeah.
Right. He'll be fine. Happy juice is going in his vein right now.
Yeah.
He just doesn't like separation.
Oh shit. Oh yeah.
Hey, man.
That was right in the nose. Good boy.
Hope he behaves. Hope he doesn't go down as the dog that kills the Supervet. I want him to be running around for as long as possible. He's a very active dog.
He's just scared. Yeah, he's just scared. I like misunderstood doggies and cats.
Me too.
9:30. Okay. Print this off for you so because that appointment for the X-rays. Right. Did you give us a claims form for the?
Oh, for goodness sake, this is really not gonna...
Like some help.
I've got it.
A challenge for you.
My life is always a challenge.
Noel's next patient is a Rhodesian Ridgeback. 6-year-old Tilly has been brought in by Andy and Michaela for an operation on her spine.
A couple of months ago, she started to sort of yelp a little bit when she was getting in and out of the car. Didn't really think very much of it to start with, and then when we were walking her, she would suddenly just sort of sit down. I just thought she was being a bit lazy, really. And then someone knocked on our front door one day and she ran out into the hallway, and she got to the hallway and she sort of just collapsed on the floor.
They did an MRI scan, didn't
Yeah,
they?
they found that she had an extra vertebrae in her spine.
We're not 100% sure exactly what he's going to do yet, but I think hopefully he's going to take a vertebrae out and sort of put a new one in.
Don't know.
That's what I'm thinking, I don't know.
He's not going to put another vertebrae back in, darling, is he?
Just one's damaged and one's extra.
One's extra, they're taking it out. Why would they put it back in?
One's damaged.
Noel first needs to assess the extent of Tilly's condition.
Stop suddenly, Andy, and just stand still. Okay, come back down again, please.
Good girl.
Okay. She sits down all the time?
Yeah,
She
all
sits
the
a
time.
lot.
Right. She's not bearing weight on the main pads at all.
Okay. All right, sweetie.
Yeah.
All right. All right, I know.
So that's the sciatic pathway. The nerve comes out here, goes down the back of the leg. The reason she feels like she's walking on eggshells is because she has sciatica in both back legs all of the time. She's really in quite extreme pain.
You wouldn't really know how much pain she's in.
Really brave.
She's braver than me.
The scans show that Tilly's pain isn't caused by an extra vertebra, but a dramatically deformed vertebra and disc.
So she was born with what's called a transitional vertebra.
Okay.
That vertebra there doesn't know whether it wants to be part of the sacrum or of the back.
So that's something she's always had.
Yeah.
We've just not been aware of it.
That's right.
Okay.
Changes within this vertebra and the disc behind it are causing complications and compression on the nerves in the spine.
That should look like that. Should be a nice big hollow hole full of fat with the nerves coming through. And if you go back as far as the disc, you'll see in fact there's no room because it's full of crud, and that crud is disc, new bone, and inflammation from the top coming down, resulting in extreme pain in all of those nerves all of the time. Now, here's what happens during the op. We go in the top, we take off the roof, we pull the nerves to one side, we go down in there and take off the roof of the disc, we scoop out the pulpy center, and then we put a large screw, which acts as a bolt, to push those two vertebrae apart. And then, because there would still be wobble, we then put a screw in there, 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 and there, and link it with rods. But one of the concerns is that the surgery to get in here and fix this moves those nerves, physically moves them.
Okay.
You could have a temporarily incontinent dog after the surgery, and sometimes doubly incontinent when they're really bad. Now, with this op, there's a theoretical possibility it may never come back.
Okay.
She's a young dog, isn't she? She's part of the family, though. She needs a good quality of life, doesn't she?
Yeah, she does.
Despite the risks,
You'll be good.
Andy and Michaela decide to go ahead with the operation.
Girl.
She'll be fine.
Does she feel a bit sick?
You do?
Yeah. It's massive, isn't it?
It really is a big operation.
I didn't appreciate how much was involved in it. That was a little bit of a shock.
Mm. I think it's worth at least giving it a go, and hopefully she'll be back to her normal self.
Good girl, Tilly.
It's 3:40 and Noel has a busy afternoon of surgery ahead. Rhodesian Ridgeback Tilly is being prepared in theatre. She's facing a high-risk operation to relieve the pressure on the nerves in her spine caused by a deformed vertebra and disc.
We're just sawing the roof off the vertebrae now. Got to be very careful because one little tap through and you could pick up a nerve and that would be disaster. The difference between success and failure here is just a millimeter. If I damage one of the nerves to the back legs, I could paralyze a leg. And the remarkable thing is how swollen they get. And the reason that Tilly's in so much pain, look at the size of that nerve. That is 5 times the size of normal.
With the nerves pulled to one side, Noel can remove the contents of the damaged disc attached to the deformed vertebra.
We're cutting with the blade, but as you can see, one false move and the nerves had it. That's what disc crud looks like. So that's the center of a degenerated disc.
Next, Noel needs to insert a spacer bolt that will separate the vertebrae and create more room for the nerves.
I think I'm going to try a size 2. It's very, very tight.
With the spacer bolt in position, Noel secures it with a screw. And to stabilise Tilly's spine, he's going to anchor the vertebra in place.
Okay, so the principle behind this system is that we pop a screw into a clamp like so, and the clamp moves in 3 directions around the head of the screw so it can lock in any direction. And then a dumbbell goes into the clamp and then goes into another clamp that goes into another screw and it holds the vertebrae apart in any direction. I got this idea from just a dumbbell in the gym. It's a relatively simple idea. So I'm just tightening those 2 clamps simultaneously, locking the dumbbell down. That's my Arnold Schwarzenegger moment. So there's 2 clamps at the back, 2 clamps at the front, and the bolt down the middle. I'm now going to put collagen in on top of the nerves. That'll stop any bleeding and cover up the nerves there. And then we close and we're out of here. Alrighty, let's go to CT.
Noel must wait for the scans to confirm if he's got the screws in the right position.
I'm pleased with the position of those screws. So you can see it's quite a narrow target there. And here on the top to bottom CT scan, you can see the spacers in here when it's pushing those 2 vertebrae apart. When you do a big surgery like this, it's very invasive. You're pulling nerves, you're stretching nerves. So there's real risks that those nerves are going to be having difficulty recovering. So it's always a bit nail-biting for the first 24 hours.
For Tilly's family at home in Surrey, it's an anxious wait, especially for 15-year-old daughter Sabrina.
Tilly's so special to me because she's like part of the family. She's like my sister, like because I don't have any siblings, so I like tell her everything, and yeah, I love her. There's always that worry that she won't be able to ever run again, and that she won't be able to be that fun, energetic dog. I just can't imagine my life without Tilly, really.
Sometimes a dog just walks through the door and everyone is like, that dog is amazing.
Oh yeah, so the cute ones draw a massive crowd. If anyone that's remotely cuddly, remotely cute, everyone's there and giving them fuss and cuddles.
They win your heart over instantly. You can't help but fall in love with dogs like that.
This dog is on a rampage.
Today, a 4-month-old cockapoo puppy is booked in to see Noel.
Hi there, who have we got here?
Monty.
Monty! How old is Monty?
He is about 18 weeks.
You know you're going to have all the nurses looking after him.
What about the dog?
Fitness instructor John got Monty soon after getting married.
You can't beat the greet you get from your dog. Come back from work and he's more keen to see you than the wife. Just the most loving, caring dog. And you know, it's exactly what we wanted. A good trial run before children, I think. But hopefully a bit smoother transition.
Monty fractured his knee when he wriggled out of wife Jess's arms.
She's devastated. But you know, it's far from her fault. And but yeah, a little bit emotional. She couldn't be here today for that reason. She was like, I can't come and leave the dog here and go off on my own. I can't do that. So I had to man up and be the one to bring him in. Hey, you little rascal.
John's been referred to Noel, who he met 15 years ago at the gym.
Good boy.
Now, Monty, please.
Come on.
Hey, mate. How are you? Long time no see. How are you?
I don't think I'll be seeing you in this environment.
No, I'm not so happy for you here. There's a special test we have to do, so you hold him tight.
Yeah, I've got him.
You're in good shape, mate. You're in better shape than me. Let's lift the arm a little bit. There you go. That's it. 1, 2, 3.
Okay, all right, all right.
All right, that's enough. Pop him down for me. Good boy. Yeah.
Good boy.
All right, big guy. Okay. I see this fracture all the time. It happens in small breed dogs, usually as a result of jump from someone's arms.
I'm not jumping out of my arms.
What's happened is the dog has fallen. This tendon with the quad has put all of the load through the strapepatellar tendon and popped that off. But not only that, I've had a look at the x-ray picture sent through from your own vet. There's another growth plate at the top there, and we can see that there's a fracture through here, and this has slipped backwards. Now, I don't anticipate I'll have any trouble putting that back in place.
Okay, that's great news.
But
There's always a but.
there's always a but. This growth plate will stop growing, which means that this leg could end up slightly shorter than the other leg.
But there is another growth plate further down his tibia bone, which will continue to grow, and if Monty's lucky, he may not develop a limp.
All right, mate, everybody's gonna love you. Come on in. This is my friend John. So this is a little dog called Monty, and we're gonna fix the right tibia today. Oh, look, I told you they'd all be in love. You can give him a cuddle.
Okay, come here.
There we go. It's lovely to see that sensitivity in you, Johnny. Right, girls, over to you. See you later.
If you want to go into theatre and help us move...
It's midday. Marley, the harness racing champion, is going into surgery. Noel needs to operate to treat the arthritis caused by dysplasia in his left elbow.
At least we should be able to get him back to happy pet function, but if we can get him back pulling a cart around the woods again, all the better. Just need a little bit of a fair wind from a biological perspective. So we're going to inject stem cells in there to try and help decrease the inflammation and put a scab over the worn part of the joint, which you can see here. So the first thing we're going to do here is extract bone marrow from the inside of the humerus.
Noel will use this marrow from Marley's other leg to isolate stem cells.
We've got to collect a fair amount of this so that Steph can go off into the laboratory and take the stem cells away. The thing about bone marrow is that it produces most of the cells that are of use in your body after you're born, and that's why it's critical for life. And within that soup of cells are pluripotential stem cells, so given the right environment, they can manufacture any kind of cell. So if you put them in the right environment, for example, you could make more bone. If you put them in the right environment, you can make cartilage.
With the stem cells now extracted, Noel begins work on Marley's damaged elbow.
It's a little bit tricky, this operation, because there's a lot of muscle and a few important bleedy things and white things that conduct nerve impulses along the way. The main moral of the story when you're doing orthopedics is if it's red and pumping, don't cut it. If it's white and stringy, don't cut it. If it's blue, if you cut it, you probably get away with it, it'll be okay. That's arteries, nerves, veins.
The centerpiece of the operation is a stepped plate that has been custom made for Marley. With the plate in the right position, Noel can now cut the humerus in half to shift the pressure away from the damaged side of the joint.
All right, so now I've done a complete cut through. I'm going to tighten these two screws here. And they're going to pull this segment of bone up towards the plate. The bone then forms a step.
An additional bracket at the top and bottom of the humerus makes the repair more secure.
This is rock solid, so it's very unlikely this bone's going to break.
The mechanical repair is complete.
Now that's ready for Noel.
And now it's time to introduce the stem cells.
So I'm going to inject the stem cells into the joint first. So that goes in there like so. Then I inject this combination of activator and glue, so that will give them a chance to stick down where they're supposed to be. Okay, let's move it about a little bit. He'll be up and walking within 48 hours, no problem. All right, let's go to X-ray.
He's so handsome. Just so handsome.
I am a little bit in love with the dog.
Hi, Melanie, it's Noel. So all in all, a good outcome, and hopefully certainly by week 6, you should be out of the woods, and by week 12, I should be able to say to you, you can go ahead and let him off the lead. And hopefully, maybe, if we're very lucky, in a month after that, we might even get him pulling something with you on it. I don't know. There's no particular anatomical reason why that shouldn't be possible. Are you crying on me now? Oh dear.
Okay, thank you.
You're very welcome. Stay brave.
Bye-bye.
All right, bye now.
Bye-bye.
Bye.
It's quite hot, isn't it? It's quite warm.
I'm getting some more water.
Go on then. Could you get me some, please?
What water?
Yeah.
Yeah.
Today, Andy and daughter Sabrina have come in to collect Tilly.
Do I get the half a cup?
Yeah.
Yeah.
It's been 2 days since she had major surgery on her spine.
She has got some metal. She went for a metal detector. She set it off, I think. She definitely would, wouldn't she?
Yeah.
But it's just really, hopefully she'll be back to her normal self. It's the main thing. No pain.
No pain. That'd be good.
Yeah.
Alrighty, look at you then.
Noel checks if Tilly's well enough to go home.
Good girl, Tilly. She's just beginning to find her feet.
The surgery she's had can cause temporary nerve damage and problems with urination.
She's a little unsteady, but she's actually walking really well considering the magnitude of the surgery she had. She's bright, she's alert, she's looking around.
Things are looking promising.
There you go. That's the one we've been looking for. That's the one I've been looking for. A nice big pea. There we go. That's the best news ever. Good girl. Well done. That's a lovely pea. Hello, how are you? What's your name? Sabrina, nice to meet you. Sorry about the delay there.
Noel talks Sabrina through Tilly's operation.
We then put a screw here and here and here and here and link it with rods.
It's clever, isn't it, Sabrina?
It's very good.
Oh, that is very good. Oh, thank you.
I'm
Thank
actually
you very much.
gobsmacked.
That's sweet. I will go and get her for you. So I'm going to reintroduce you in the yard because I don't want her to slip on the floor.
She'll be coming out in a second. I can hear her.
Tilly!
Well, slow down, Tills.
Now, hello, Daddy.
Good cow.
Hello.
Hello.
Oh, your root is gone now. Yep.
There we go.
In you go, Tilly. There you go. You seem so much happier.
She is a lot happier, yeah.
You are.
Yeah, she is a lot happier.
You're back.
There you go.
I missed you so much.
There you go, Beanie. You got your friend back.
It's early evening.
I'm going to set up my theatre. That's the sort of person I am.
Monty, the cockapoo puppy, is being sedated and prepared for surgery on his fractured knee.
Oh! Lucky Moses.
You are mischievous. Given.
Puppy, puppy, we go to sleepy. Lie down. Clever puppy.
Hi.
Look at you. You're so cute. He gets so nice and relaxed with his pre-med, and then someone else comes along and strokes him, and then he's like, he's sleepier than he was.
You're not helping.
No.
Trying to sleep,
Sorry.
puppy.
Oh my gosh, you're really cute.
At Monty's home in Woking, his absence is sorely felt.
We fell in love with Monty straight away, and I don't think you can ever prepare yourself before you get your own dog. You don't ever think you'll love them that much, but we love him so much and we just can't imagine life without him now. Makes you feel a bit more whole as a family.
Monty fractured his knee jumping out of Jess's arms.
I was devastated. There and then, I knew it was bad because he yelped and he was holding his leg up and it was floppy. And I suppose at the time I just thought, that's it, you know, game over. He's never going to be the same again.
At the practice, Monty's operation is about to begin. To fix his knee, Noel needs to reposition the kneecap, secure the tendons, and repair the break in the growth plate.
What we're going to do is we're going to drive a pin down through the back of the joint here into the bone. And the thing is, you have to do all of this by feel. You can't actually see the fracture because the fracture's hiding in here. I've isolated the back of that piece of bone with this needle. I'm now going to isolate the front with this pin. I'm going to use the forceps to pull the front part of the tibia and the kneecap tendon back down. A little bit of orthopedic twister here.
With the bones and tendons back in position, Noel now needs to anchor them in place.
We got 5 pins in now, 2 on the inside, 1 on the outside, 2 in the front.
A loop of wire will prevent the kneecap from pulling upwards.
Now we've got a figure-of-8 band pulling against the kneecap tendon. So when the knee flexes and extends like so, there's a pulley pulling against the natural pulley so that that bit of bone can't flip up again. So that's it, done, ready to close.
Let's go, puppy, little
Thank you.
Go, go.
If Monty can stay out of trouble, he should be able to go home in the next 3 days. It's 7 p.m. Just 24 hours after Marley's surgery on his elbow, Mel's had an urgent call to come in.
He's been quite a handful. He absolutely does not like us. Doesn't like the nurses, doesn't like me, doesn't like anybody. He gets on all right with Mike, my intern, but that's about it.
Stay. Calm down. Marley is one of the more difficult dogs that we've had to deal with since I've been here. However, I think that there's always a way to get through to each dog. I think he has trust issues.
Don't take it off yet. Do not take it off yet.
Joe, please don't.
Such is life, you can't win them all over.
Noel has no choice but to send Marley home early.
Hey Melanie, how are you?
Yeah, I'm good.
He's not been happy, boy. He just, like, it turns like that. We have not found any way around it. That's him, ready to come in. He literally, up and down.
Come on, bud. Oh, watch out.
We're gonna need to just see how he gets on at home.
One of Noel's concerns about Marley's recovery is the risk of infection.
Hello, gorgeous.
It's critical he wears a recovery collar to stop him licking his wound.
Good boy. I know what we've done to you, eh? Do you want to go in the van? Yeah. Oh, yeah, yes. Good boy.
But Mel needs to return Noel's lead.
Good boy. Hey, baby. All right. All right.
You can just bring the lead back another time, can't you?
Yeah.
The collar didn't last long. My concern would only be that he would lick the wound.
All right.
Do you want sedatives for him?
Yes, please.
Okay, no worries.
Oh, baby. Dear.
Right, give him 1, 1.5, or 2, depending on how many he needs, up to 3 times a day. Don't take him yourself, no matter how stressed you get.
Okay, thank you.
All right. Try not to get eaten.
Not to.
I don't want you coming back. Mate, you got to behave yourself. A little bit unpredictable, aren't you, buddy?
Oh, whites of the eyes.
Yeah, I know. He'll be fine at the end of the day if he can just get through the next 2 weeks. Stay brave.
Thank you.
All right, cheers.
He's never been like that before with me, and that's really unusual, and it's quite distressing actually. But I'm trying to just stay calm, and let's just keep fingers crossed that he doesn't do anything silly and undo what's been done.
Three days after his operation, Monty's getting ready to go home.
Oh, you've got a shitty ass!
Oh my goodness, is that what you were trying to get at this whole time?
Oh my god!
You're definitely not going to enjoy this like you do eating. Now you can see the hole!
John and wife Jess have come to collect him.
No. Put it in the bin, there's a bin over there.
Monty, Mum and Dad.
Hello, how are you? Lovely to meet you.
How delightful to meet you.
Thank you.
Your little baby is doing fine.
Good.
The point is, don't beat yourself up, because this happens all the time. It literally happens all the time.
I just feel like he's so young to have this done.
No.
It's more that he's so tiny.
I told him, I see 10 or 12 of these a year.
I don't think that's that many.
Well, that's
I'd
one a
rather
month.
You said like 5 a month.
It's
not
one a month. Everybody cuddles their puppy, and puppies jump. So this happens.
Okay.
When he jumped, he twisted his leg. The top of the tibia came off because that's a weak growth area. So that's pulling it back in place with 2 pins and a pulley wire, so that pulley pulls against that pulley. So the quad and the kneecap tendon don't pop that off. And then the top of the tibia is put back on with these 3 pins.
Okay.
Let me get him for you. Come on, mate. Here you go.
Hello, rascal. My boy. Hello, look
Pick
at
him up
your
so he doesn't
leg.
struggle.
Mama's boy. Hello, Teddy.
To be fair, when John left the other day, he was quite emotional. I'd never seen him like that.
I just kept sobbing. It's awful. Oh, hello. Noel was amazing, and he was so kind, and he did try and reassure me, but it's still our puppy, and I feel like he still had to go through a massive ordeal, and I do feel really bad about that.
Yes. What's this? I'll go down and do my leather, will you? Super happy to have him back. We'll fill him with some treats, and that's it. He'll be back to normal. As you can hear, he's already going nuts. So keen to get out, and I think so are we now. So I think it's all good.
Marley, the harness racing champion, is back to see Noel. It's been 6 weeks since he was sent home earlier than expected because he was becoming irritable with the staff following his elbow operation.
The first week was horrible, really, truly horrible. He really turned on me actually for a few days and scared me quite a bit, never mind other people that came near him. So it was really difficult, lots of tears. I really doubted in those few days that I'd ever get him back again, but I moved my bed downstairs, so I slept on the floor in the living room with him, and you know, let him come to me in his own terms, and he came for cuddles, and we've slowly sort of built up that trust.
But Marley still has a long way to go until he's fully recovered.
Hi, Marley. How are you doing?
He's doing
Hello.
good.
How is his temperament?
It was touch and go for a while. Come here.
Yeah, well, the first 2 weeks were brutal, weren't they? Hey, Marley, good boy. It's fine, it's fine, it's fine. Good boy, good boy, good boy. I'll
He's
be
forgiven you, look though.
Yeah, but he's only doing that because I don't have a needle in my hand.
Oh, hey, you don't like cameramen, do you?
Let's see him walk.
Steady.
That's great. That's excellent. There's no way I would expect it to be better than that.
Okay.
Noel can't be certain of Marley's progress until he sees the X-rays.
No, big fella. It's okay, buddy. It's all right. So just give Mummy the muzzle. There we go. That's it. There we go.
With an anxious dog like Marley, that's easier said than done.
All right, guys, off you go. You come with me. You come with me. Come with me. Come with me. Come with me. They've got him. They've got him. I think it's best to separate you two. Okay?
Time for coffee. Bring scent out. He's going to be known for the dog that terrorised everybody at Fitzpatrick's.
So when no one went to touch him, he didn't like it?
Well, he was fine up until then. Well, he doesn't like the cameraman very much.
For Mel and Marley, it's crucial the results of the X-rays show progress.
He's not the same dog when he's not able to be active. There's a lot of pent-up energy there, and it does result in bad behaviours with him. So, you know, actually being able to have him running around is going to be fantastic.
Harness racing champion Marley needs a series of X-rays to find out if the operation on his elbow has been a success. If it's good news, Mel can step up his exercise, a good antidote for his difficult behaviour.
He was well behaved once he had a jab in his arse. We'd all be well behaved with a jab in our arse. So if we look at the healing on this osteotomy now, what I want is solid bone forming through there. The whole point is to create an S-shaped bone so that instead of the weight going down equally on the inside and the outside, it is in fact going toward the outside more. Okay? Mm-hmm. And this is looking real good. So this is really good for this stage post-op, actually. I'm very happy with that. Come on, big fella. Good boy. It's fine, buddy. There we go. Now you can take the muzzle off.
Hello, baby.
Fine. Good. Thanks.
There we go. Good.
Okay, take care. See you later, mate. Good boy.
To see the X-ray and, you know, to see how well it's all worked, I mean, it's exactly how it should be. I'm chuffed to bits. You know, it would be nice for him to be able to run around again, but I'm sure he would be way too bouncy right now if I let him off lead, so just got to keep him under control. If he can run in harness again in the future, that would be a real bonus. That would be awesome. But we'll see how he goes.
In Surrey, it's been 10 months since Tilly had surgery on her spine.
Time for walkies. Come on. That's it.
Sabrina, Andy and Michaela are taking her out for long walks.
Go!
Come on!
Tilly having the op was really worthwhile. She's gone back to her normal self and she's a happy dog again.
It's amazing. No, never thought she'd be like that at all. She could hardly walk, really, so the fact that she's running like that is just fantastic. Lots of energy.
It was definitely worth it, definitely.
She should have a good, maybe 6-7 years left. That makes me happy because I like running around with her and she's enjoying herself. You can see that she's happy and sort of having fun.
You know, hopefully we'll have a lot more years with her while she's like this and keep Sabrina happy.
Okay.
After 2 months of cage rest, Cockapoo Monty is also raring to go.
He's got so much built-up energy over the last 6 to 8 weeks that he's been caged. He's just keen to get out and go back to his normal self.
When it first happened, I thought that'd be it. No more walks.
The progress he has made has been absolutely great.
We feel like we've got our puppy back. I think I still feel bad about what's happened. I think I always will because he still had to go through quite an ordeal. But I've realised a dog's a dog at the end of the day. And
he's probably forgotten it's even happened.
I'm safe to say I think it's put me off having any more dogs and possibly even children in the next year or so.
Brilliant, that's so good. Really, really happy about that.
I think just the 3 of us for now would be nice.
And in Hampshire, Mel is now able to let Marley off lead, which may be a mixed blessing.
Oh, no! Oh, Marley! Oh, he's doing great. He's a lot happier. He's not on any painkillers anymore. He's got an ever so slight limp when he's trotting along, but I think that's more to do with, you know, the muscle not having built up yet. It's just great to see him running around like that. It's definitely worth having his elbow operated on. I'd love to see him running with his team again on a 4-dog rig, or even just doing a bit of biking and scootering, but it's not the most important thing. The most important thing is that he feels he's got a job to do, and that he's got that release so that he's not the anxious dog he can get. Maybe, just maybe, he can actually do some racing again, which would be lovely. Come on, go, go.